I went to a health place, and people do blood pressure tests and things like that. But people were standing in line hours and hours. Waiting to get free care. That was being provided by doctors of all the caring types. In animal stalls, believe it or not, animal stalls. It was raining that day, and people were lined up behind me waiting for this care. It was not their discretion. They didn't want to be there. They didn't love to go to the doctor some other time for their convenience. Many of these people are insured. We're insured. But because they're insured, they couldn't pay for the drugs. They couldn't get paralyzed. They can't go to different things. They couldn't go to the doctor. So they wait once a year. This organization has been doing this for 10 years. It's called Remote Area Medical. The group puts this on. They started out flying doctors to remote villages in the Amazon and other places that people don't have access to care at all. Unlike this country, we have a lot of good care that presumably is available to our citizens, but most people don't have it. We have the most insidious form of rationing in the developed world. We have wonderful facilities, but so many people can't get care. So this organization started providing care in these primarily rural areas initially. Just last month, though, they provided care in Los Angeles, which was a big room area. Because they saw that there's a great need in this country for the same kind of services they were providing to people who live in mental health villages in third world countries. When I walked through the gates and I saw that, it just struck me like, this is really what is going on in the lives of so many people. I told you about my background. A lot of the people that are neighbors. I need to do that because it's so long now. I'm on my work. 2 weeks later, I was back in the office, but I didn't know what to do with that experience. I knew that I couldn't stay in my job very much longer, but I didn't know what I was going to do. How do you just walk away from a job at age 56 and then what do you do? But I was flying a corporate jet from Philadelphia, Connecticut. I was on flying with the CEO, and the flight attendant who works for the company served us our lunch on Golden Rim, China. Gave me some gold-plated flat-bread Edinboro, and it cost $5,500 an hour just for jet fuel. The CEO of the way then picked up his home by a chauffeur, drove to the office. While at the office, he and his other direct reports brought their lunch free. Not free, you paid for it, you paid for lunch. And then when it's time to go to Connecticut, the chauffeur is there waiting to take us to the airport, private payment. We get on the plane, fly to Connecticut, you pay the jet fuel, pay the flight attendant for my lunch. And it just hit me that for the first time I realized people's premiums are paying for me to travel this way. And for my CEO to get free lunch. My CEO makes $20 million a year for we send free lunch. And then you have people lining up in animal stalls. So that's why I quit. Quitting was the second hardest thing that I've ever done. The hardest thing was to decide to speak out against the industry that I worked for 20 years. I was watching TV just this past March, and there was a day, I think it's a day day the president was having his summit at the White House, in which he invited representatives from all the big industries, the insurance companies, the pharmaceutical companies, the AMA, the medical device manufacturers, the White House, this big healthcare summit to talk about what are we going to do, how are we going to reform this healthcare system. I don't recall there being a citizen level, but maybe there was, I don't know. But the guy making the big bucks for that, for sure. And they going back to the White House, so I'm kind of baffled about what's going on with the White House through. But after that, I was watching MSNBC and saw Chris Matthews talking about healthcare reform. And he had somebody in the industry who I know and saying the industry is different this time. We're wearing white hats. We're going to be at the table with real solutions this time. And he was so good, and these guys are good. He was the PR guy and stuff like that. Chris Matthews said, well, this time things are different. The worm is turned, the cosmos has shifted. Well, that was part of what I call the PR charm campaign the industry is conducting. A few hours later, I saw the dark side of the PR campaign. So they conduct duplicitous campaigns. One is what they want you to know and want you to see. The other is what they don't want you to know that you have anything to do with it. They had a congressman from my home state, Tennessee, on there talking about the uninsured. And he was maintaining that half the people who are uninsured are that way by choice. And this guy represents a district that has some of the most poorest counties in this country. And he's saying that people just choose not to have insurance. They don't want to pay for it. And I was just absolutely stunned. And he was using the term that we use down there. They decided to go negative. That's what the industry says. If someone makes a conscious decision not to get insurance, the industry says they decided to go negative. So I knew that was words that I used to write. He was a shield for the industry. And they've got plenty of shields in Congress, plenty of shields in the media, in business. And I said, I'm just not going to sit back and let this happen. I'm going to start speaking out. So folks, that's what I'm doing, why I'm doing this. I'm very much in favor of the public option. Shut up and get other people speaking and ask questions, but I am very much for public option. Yes, as the president has said, it is the best way to give people another choice. So that your dollars don't have to go into some investor's pocket or some consumer's pocket. You can get basic coverage, and it will serve to help you use private choices for companies more honest. Thank you.